Welcome to my channel. The video today is made for public awareness. Over the past few days through social media, a video has been circulated where a religious scholar died of rabies or hydrophobia after being attacked. It is a horror scene. If you know about it, you will be astonished. Every year, nearly 100 million people worldwide are affected by rabies only due to dog bites. Approximately 59,000 people died each year, mainly in Asia and Africa. If someone is infected with rabies or hydrophobia, their death is confirmed. As there is no cure, so there is no alternative to raising awareness about rabies. So in today's video, I will discuss about number 1. What is rabies and why does it occur? What are the symptoms are manifested when someone is affected by rabies? What is initial treatment of rabies or dog bite? How should one get vaccinated if bitten by dog or cat? What are the prevailing myths about rabies in society? And answering some questions that are rarely discussed. So let's get started. Before that, it is essential to know some information about the rabies virus. Rabies virus is an RNA virus belonging to the Lissa virus group. When someone is infected with the rabies virus, it is referred to as a rabies or hydrophobia. Rabies is primarily a zoonotic disease, meaning that it is spread from animal to humans. According to research, an average 600 to 700 people are bitten by dogs every day. So let's discuss the more details. The rabies virus is primarily present in the saliva and nerves of the infected animal, especially in the salivary gland. When the virus is released from the salivary gland, it can enter the bloodstream of healthy human through any means, causing the person to be infected with the disease. Alternatively, if the virus directly entered the human body, the individual can also be infected. Once the virus entered the nervous tissue at the site of infection, it travels at the rate of 12 to 24 mm per day toward the brain and spinal cord. Once the rabies virus entered the brain tissue, death is 100% confirmed. Rabies is primarily transmitted through the bite of an infected animal. Approximately 93% of human rabies cause the rest of dog bites. Additionally, the remaining 7% can be attributed to bite from other animals such as cat, fox, monkeys, bats, cow, horse, even rodent. It is important to remember one thing here. Rabies is not transmitted simply a healthy dog or animal biting or scratching. If a person is bitten, scratched or licks open wound by dog or cat or others potentially infected animal, there are a risk of contracting rabies. Viruses are also transmitted through direct contact with the mucus of infected animals. So, how can you sure if a dog or animal is infected with rabies virus? It is not possible to determine, but some signs can be observed, such as the dog may have excessive drooling and may prefer to stay alone or be irritable. Unusual behavior like over excessive or crying. If you are not 100% sure about the dog, it is crucial to administer the rabies vaccine without delay. Once infected with rabies, death is confirmed. Therefore, it is essential to take the vaccine promptly without any risks. How do you administer vaccine and how many vaccines should be taken? Once attacked by rabies, there is no cure. If a dog or cat bites, immediate measures should be taken, such as administering the rabies vaccine. How many doses of vaccine should be given and how should it given? According to the World Health Organization, if a dog or cat bites, it is categorized into the 3 categories. Category 1. Those who say that the dog or cat has touched the leg, scratched them and rubbed against the body or legs, there is no bleeding or burning sensation, these fall under the category 1. In other words, those for whom there is no bleeding are included in category 1. In the case of category 1, there is no need to take any vaccine. What needs to be done is to clean with antiseptics or wash with soap for 15 minutes because soap destroys the rabies virus. Category 2. If an animal is scratched but there is no bleeding, it falls under the category 2. Or if there is a slight bleeding in the area of bite or burning sensation, it will also include it in category 2. In this case, the affected area should be washed with soap containing antiseptic for at least 15 minutes and the rabies vaccine should be administered. The vaccine should be given in 5 doses. It must be given in the deltoid muscle of the arm. For children under 2 years, it should be given in the thigh muscle. Under no circumstance should be given to the buttock. The 5 doses should be given on the 0, 3rd, 7th and 14 and 28 days. That is, after starting the vaccine, 5 injections should be given within 28 days. However, currently 4 doses are given intradermally under the skin. It is administered 0.2 ml each under the skin on days 0, 3rd, 7th and 28 days. If there are single or multiple deep bites or scratch bleeding from the bite, muscle being torn and exposed due to the direct contact with the bath, then follows category 3. Alternatively, if the bite occur on the head, neck, chest or back, even in category 2, it will be included in category 3. In category 3, the following steps should be taken. Number 1. Wash the affected area with soap containing antiseptics for at least 15 minutes. 2. Then according to the schedule administered 5 rabies vaccine. 3. Along with the vaccine administered human rabies immunoglobulin at the wound site, it should be given around the wound. Number 4. The tetanus vaccine should be taken because the external dog and cats can carry germ that can lead to tetanus. 5. Antibiotics should be taken for wound healing. 6. Painkiller can be taken for pain relief. If necessary, please consult a registered doctor. Let's discuss the symptom when someone is infected with rabies or hydrophobia. Generally, the first symptom of rabies appear within 3 to 7 weeks after the virus enters the body. However, in some cases, symptoms may be manifested anywhere from 1 week to 1 year after exposure. The presentation of symptoms depends on where the bite occurred and extent of the injury. In 81% of cases, symptoms of rabies are usually observed within 20 to 90 days. 70% of patients infected with rabies die within 59 days from the onset of bite. In initial 7 to 10 days, some symptoms are observed. Number 1. Fever and spasm of muscle, pain, discomfort around the wound area, burning sensation or itching in the wound site. Generally, 2 types of rabies can be observed. Number 1. Furious rabies. Individuals with furious rabies exhibit the hyperactivity, excessive salivation, confusion or aggressive behavior. They may also experience fear when they are exposed to light. Subsequently, severe symptoms known as aerophobia and hydrophobia occur, and the patient becomes terrific when seeing water. The patient may be unable to drink due to muscle spasm caused by the disease. Number 2. Paralytic rabies. This type accounts for about 20% of rabies cases. In paralytic rabies, the infection site around the bite site and gradually progress the paralysis. Over time, the patient advances toward paralysis, eventually leading to death. How can one determine if they have infected with rabies through test? Answer is no. As of now, there is no specific test that can be determined whether a person will be infected with rabies. Generally, the diagnosis is based on observing symptoms and the patient's fear of water and air. Some things should be avoided if bitten by dog or cat. Number 1. Do not stitch the wound. Sewing up the wound is not allowed as there may be tetanus bacteria in the wound. In case of excessive bleeding, use secondary closure as a measure. Number 2. Any cream or ointment should not be used at the wound site. Number 3. Do not seek treatment from any charm practitioner or traditional healer. 4. Do not consume the leftover food of person infected with rabies. Now let's discuss the social misconception. Some people believe that when someone is bitten by dog, the patient can give birth of puppies in the stomach. This is sometimes referred to as puppy pregnancy syndrome. This is a cultural or social misconception is not based on medical reality. Answering some basic question. Number 1. After getting the rabies vaccine, how long does it remain effective? Answer. Generally, the effectiveness of the rabies vaccine at least about 2 to 3 years if complete the series of 5 doses is taken. Number 2. Can pregnant women receive the rabies vaccine? Answer is yes. Pregnant women can receive the rabies vaccine. It is safe for them. Number 3. What should I do if I miss one dose of rabies vaccine? Answer. If you miss one dose of rabies vaccine, there is generally no problem. You can take the missed dose as soon as possible, and remember, next dose should be given according to the time. Number 4. I have taken 5 doses and now I have been bitten by dog again. What should I do? Answer. If you get bitten within 3 months of completing the rabies vaccine series, you do not need to take any additional vaccine. However, if it has been more than 3 months but less than 2 years, you may need to booster dose. But if it have been more than 2 years, you may need to restart the vaccination series with 5 doses. Number 5. After a dog bite, when should a rabies vaccine be taken? It is recommended to take rabies vaccine as soon as possible after the bite. Getting vaccinated within 5 days is considered the most effective. If you can get vaccinated sooner, that is even better. 6. Do you need to take vaccination if a child dog or cat is bitten? Answer is yes, they should need to take vaccination if a child dog or cat is bitten. It is advisable to those who keep pets at home to ensure that their pets are vaccinated against rabies, because you can also affected by your pets. So I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.